effective.
Contraceptive
Pill?
pill. Oral contraceptive pills consist of the hormones progestin and estrogen, or only progestin, and must be taken orally once per day in order to prevent pregnancy. Currently, there are 3 different types available on the market: the combination pill, the progestin-only pill, and the continuous use
Advantages.
pill. The advantages: the birth control pill is a safe, simple, and convenient way to prevent pregnancy. It also has other benefits like reducing acne, making your periods lighter and more regular, and easing menstrual cramps.
Disadvantages.
Disadvantages: some disadvantages of the pill include it can cause temporary side effects at first, such as headache, nausea, breast tenderness, and mood swings. If it did not go after a few months, it may help to change to a different pill. It can increase your blood pressure.
Transdermal
Next
patch.
is transdermal patch. Transdermal contraceptive patch is a safe and convenient birth control method that really will if you always use it correctly. You wear the patch on certain parts of your body, and it releases hormone through your skin that prevents pregnancy. The patch has a lot of other health benefits too.
Advantages.
The advantages: transdermal patch deliver drugs directly into the circulatory system, bypassing the gastrointestinal system and avoiding the hepatic first pass effect. This delivery system is advantageous treatment of depression with monoamine oxidase inhibitors, or MAP.
Disadvantages.
Disadvantages: PAD is not a perfect means of contraception because of some drawbacks listed below. It does not provide protection against sexually transmitted infections, including HIV. Must be prescribed by a health care provider. The estrogen levels are higher with the patch than with other hormonal methods. Side effect: rash, redness, eye pain, redness or discomfort, blurred vision, seeing halos or color image, agitation, seeing things or hearing voices that do not exist, and confusion. Next is vaginal ring. The vaginal ring is a small soft plastic ring that you place inside your vagina. It releases a continuous dose of the hormones estrogen, progestogen, in the bloodstream to prevent pregnancy. To use a vaginal ring, you squeeze the ring and insert it into your vagina like inserting a tampon. It stays in your vagina for 3 weeks. You then take it out and throw it away and wait 7 days before inserting a new ring. The advantages: benefits other than contraception include regular menstrual cycles, less blood loss with periods, less iron deficiency or anemia, less menstrual pain and cramping, reduced risk of ovarian and endometrial cancer, fewer functional ovarian cysts, ectopic pregnancy, and less thin breast. The disadvantages: you may not feel comfortable inserting or removing it from your vagina. You can have something, spotting and bleeding in the first few months. It may cause temporary side effects such as increased vaginal discharge, headache, nausea, breast tenderness, and mood changes. Subdermal implants. Subdermal contraceptive implants involve the delivery of a steroid progestin from polymer capsules or rod placed under the skin. The hormone diffuses out slowly at a stable rate, providing contraceptive effectiveness for 1 to 5 years. Period of protection depends upon the specific progestin and the type of polymer. The advantages: advantages of progestin implant include long-term contraceptive action without requiring the user of provider attention, low dose of high effective contraception without the use of estrogen, fertility is readily possible after the removal of implants. Disadvantages. You may experience temporary side effects during the first few months, like headache, nausea, breast tenderness, and mood swings. Your period may be irregular or stop altogether. You may get acne, or your acne might get worse. Next is hormonal injection. Contraceptive injection prevents pregnancy by injecting a synthetic version of hormone progesterone called diphenhydrocyprogesterone acetate or DMPA. The injection is also called DEPO. DEPO prevents the body from producing its own hormones and releasing eggs from the ovaries. The advantages. It can be useful for women who cannot use contraception that contains estrogen is not affected by other medicine. Side effects can include weight gain, headache, mood swings, breast tenderness, and irregular bleeding. Your periods may become more irregular, heavier, shorter, lighter, or stop altogether. Suturing device. An IOD is a small T-shaped plastic and cover device that put into your womb or uterus by a doctor or nurse. It releases copper to stop you getting pregnant. It protects against pregnancy for between 5 and 10 years. It's sometimes called a coil or copper coil. Advantages. It protects against pregnancy for 5 or 10 years, depending on the type. Once an IUD is fitted, it works straight away. Most people with a womb can use it. There are no hormonal side effects, such as acne, headache, or breast tenderness. Disadvantages. There are certain disadvantages of the intrauterine devices. There are IUDs are expelled without the knowledge of the wearer is about 10 to 15% of the women, and they run the risk of becoming pregnant. There is risk of perforation of uterus and infection. They can cause excess menstrual bleeding and pain. So next is chemical barrier. Chemical barrier or spermicides are sperm-killing substances available as foams, creams, gels, films, or suppositories, which are often used in female contraception in conjunction with mechanical barriers and other devices. Spermicides are usually available without a prescription or medical examination. Advantages. This method does not affect a woman's menstrual cycle. The ability to get pregnant returns as soon as a woman stops using birth control. Barrier methods cost less than hormonal type birth control. You do not need a doctor prescription for condoms. The contraception sponge or spermicide. Disadvantages. It can cause temporary side effects at first, such as headache, nausea, breast tenderness, and mood swing. If this does not go after a few months, it may help to change to a different pill. It can increase your blood pressure. It does not protect you against sexually transmitted infections. Side effects. Side effects include menstrual changes, heavier bleeding, amenorrhea, or oligomenorrhea, changes in weight, headache, dizziness, nausea, and cardiovascular impacts. In addition, women may harbor fears of long-term effects of contraceptive use, such as infertility and childbirth complications. Next is diaphragm. A diaphragm or cup is a barrier method of contraception. It fits inside your vagina and prevents sperm passing through the cervix, the entrance of your womb. You need to use it with a gel that kills sperm or spermicide. The advantages of diaphragm or cup. You only need to use a diaphragm or cup when you want to have sex. You can put it in at a convenient time before having sex. Use extra spermicide if you have it for more than 3 hours. There are usually no serious associated health risks or side effects. Disadvantages of diaphragm or cup is not effective as other types of contraception. And it depends on you remembering to use it and using it correctly. It does not provide reliable protection and against STI. It can take time to learn how to use it. Next is cervical cup. The cervical cup keeps sperm from entering the uterus by covering the cervix. For added protection, spermicide is put in the cup before inserting the cup snugly over the cervix. The cup can be put in several hours before having sex and must be left in at least 6 hours after sex. Advantages. Unlike the diaphragm, the cervical cup protects against pregnancy for 2 days or 48 hours and for multiple acts of intercourse within that time frame. When placed appropriately, the cervical cup is often not filled by either partner during sexual intercourse. And the disadvantages. The cervical cap is more difficult for women to learn to insert and remove than the diaphragm. If worn for more than 2 days or 40 hours, you run the risk of toxic shock syndrome or unpleasant vaginal odor and discharge. Mild allergic reaction to the silicone or spermicide occasionally occur. But possible side effects may include from the spermicide irritation of the vagina and surrounding skin or an allergic reaction. Strong odors of vaginal discharge if the cup is left in too long. An allergic reaction to the material in the cup. This is rare. Sometimes rare. No, sometimes rare. Sometimes happening. Change in the cervix because of irritation. Next is male condom. Place the condom over the tip of the erect penis if there are teeth on the end of the condom. Use your thumb and forefinger to squeeze the air of it. Gently roll the condom down to the base of the penis. If the condom will not roll down, you may be holding it the wrong way. Male condom is for male sex. Advantages. Some advantages of using condom. When used correctly and consistently, there are reliable methods of preventing pregnancy, protecting both partners from STIs, including chlamydia, gonorrhea, and HIV, or disadvantages. The disadvantages of using condom. Those with latex allergy may not be able to use regular condoms. Reduce sensitivity during intercourse. is a common voice concern with couples who opt for condoms as a contraception method. Condoms cannot be used with oil-based lubricants, only water-based ones. Condoms have no side effects. Next is female condom. Female condom. While holding outside of condom and close ends, place sides of inner ring together with your thumb and forefinger and insert into vagina. It is similar to inserting a tampon. Using your finger, push inner ring as far up as it will go until the rest against cervix. Advantages. Female condoms help to protect both partners from STIs, including HIV. When used correctly, they are a reliable method of preventing pregnancy. It's a form of contraception you only need to use when you have sex. There are no serious side effects of using condoms. Disadvantages of female condoms. They can slip out of place during sex. Excuse me. They can irritate your or your partner's skin. They might make the sensation of sex less intense. They're slightly less effective at preventing pregnancy and STDs than male condoms. Next is surgical methods. Surgical methods procedure for family planning includes tubal ligation for female, sterilization, and vasectomy for male sterilization. Tubal ligation. Advantages. More than 99% effective at preventing pregnancy. Blocking the fallopian tube and removal of the tubes should be effective immediately. But use contraception until your next period. It will not affect your sex drive or interfere with sex. Disadvantages. Some of disadvantages of surgical sterilization include the following. It requires surgery, usually under a general anesthetic. This is a risk, albeit low, or surgical complications such as internal bleeding, infection, or damage to another organs. Next is the natural method. First is abstinence. Abstinence is simply not having sexual intercourse. If you are abstinent, it means you decided not to have sex. This includes vaginal, oral, and anal sex. Abstinence prevents pregnancy by not giving the opportunity for semen to enter the vagina. A sperm can't fertilize an egg if you don't have intercourse. Advantages: academic performance. Is it easy to concentrate on your studies? After all, it's not what you came to college for. It is better your health. Probably have fever, physical and emotional concerns, and certainty. If the relation lasts 6, this is a good chance it will be a strong relationship. And confidence. You know that the other person likes you for you and not just for sexual attraction. Freedom from worry. So you have no concern about untendedly and or sexually transmitted infection. Also, there will be less confusion about relationships that become intense too fast. Good example. babysitting one for your peers or younger siblings. Less less stress. There will be time to learn more about yourself and your feelings. And peace of mind. You won't be risking your future for a few minutes of pleasure now. Simplicity. You won't have to worry about birth control. Security. It feels safer to know a person better and wait until you think this is the person you may want to spend the rest of your life with. Self-respect. You know that you are able to stand up for what is right for you. The disadvantages. Experience shows that even people committed to abstinence may unexpectedly have sex and may not be prepared to protect themselves from pregnancy and STIs. Many people may find it difficult to maintain abstinence over the long term. Choosing abstinence does not mean that your desire for sexual activities goes away. Are there any side effects to abstinence? Not having sex for a long time should not have negative health effects. There's no right or wrong way to express sexual feelings, as long as everyone involved is clearly consisting. No one should ever feel obligated to have sex. Avoiding sex will not harm a person's health, and it may even be healthy. Next is the calendar methods. The calendar method or the calendar rhythm method is a form of natural family planning. To use the rhythm method, you track your menstrual history to predict when you ovulate. This helps you determine when you're most likely to conceive. What are the advantages of calendar method or rhythm method? Thus, by calculating the midpoint of the cycle, women can also work out when they are potentially fertile and when they are definitely infertile. Sex can then be avoided or an alternative methods of contraception used on fertile days of the cycle. What are calendar methods? Advantages and the disadvantages. What are the disadvantages of calendar rhythm method? Some of the other cons of the rhythm methods are it can be annoying to record and track your cycle every day. No protection against sexually transmitted infections. Challenging for people with irregular period. Next is the basal body temperature. Basal body temperature can be used as a way to predict fertility or as a part of a method of contraception. By helping you gauge the best day to have avoid unprotected sex. Good. Tracking your basal body temperature for internal fertility or contraception is inexpensive but does not have any side effects. What are the advantages of basal body temperature? Basal body temperature can be used as a way to predict fertility or as part of method of contraception by helping you gauge the best day to have or avoid unprotected sex. Tracking your basal body temperature for either fertility or contraception is inexpensive and does not have any side effects. What are the disadvantages of basal body temperature? What are the drawbacks of basal body temperature method? The basal body temperature methods may not accurately predict ovulation in all women, including those with irregular menstruation cycles. It offers no protection from sexually transmitted diseases. Next is the cervical mucus method. The cervical mucus method is a way to identify fertile times to help you guys the best days to or avoid unprotected sex. What are the advantages of cervical mucus method? The cervical mucus method is a way to identify fertile times to help you gauge the best days to have or avoid unprotected sex. Tracking your cervical mucus for either fertility or contraception is inexpensive and does not have any side effects. Some women choose to use the cervical mucus method for religious reasons. The disadvantage is that this method is not always easy to learn without the guidance of your OB/GYN or doctor. OB/GYN. Next is symptothermal methods. Symptothermal methods, a fertility awareness method used to predict when a woman might be fertile. The method uses body temperature and other signs and symptoms of ovulation. The symptothermal method has a significant advantage in effectiveness because it combines the calendar, cervical mucus, and temperature methods. However, this technique shares the same disadvantages that each of these techniques has individually. So next is ovulation detection. There are several ways to detect ovulation, including urine tests, kits to measure LH levels, transvaginal ultrasound, endometrial biopsy, blood test to measure hormone levels, and the basal body temperature chart or BBT. Advantages: ovulation test kit may be beneficial if you have slightly irregular periods or find other methods of tracking your fertility difficult or unreliable. So disadvantages: ovulation test kits can be expensive and there are no guarantees. Coitus interruptus or withdrawal. Coitus interruptus, also known as withdrawal, this is a traditional family planning method in which the man completely removes his penis from the vagina and away from the external genitalia of the female partner before he ejaculates. Coitus interruptus or withdrawal as a contraceptive method technique does not make use of artificial devices. However, it does not have several disadvantages. First, men discharge a small amount of semen before ejaculation. Second, men withdraw their penislet and inseminate the female. And three, side effects include loss of sexual. So, those are the contraceptive methods and the natural method. So thank you for watching and thank you for listening.